today. And Rebecca, if you wouldn't mind reading the roll call, please.
Sure. Dr. Brown is not here. Okay. Robin Hill Dunbar, I know is not able to make it today. Brittany Kassim Karu,
Here.
Peg King,
Present.
Kali Thorne Ladd, Christopher McMorran. Uh, Dr. Brown is just joining us. Joel Metlin,
I'm here.
Ramonda Olaloye. Okay. Julie Seastream had let me know ahead of time she's not able to make it this time. Jillian Wiesenberg and Kate Wilcox.
I am here.
Great.
And we noted Dr. Brown joined just after his name was called.
Great. Great. Well, thanks again for coming. And welcome to any guests that we might have, and certainly welcome to the presenters that are going to be participating in the meeting today as well. So let's go on to our goals. We want to connect and share updates on the home visiting programs and systems. We will debrief a little bit about the HVAN launch and review and provide some input on the next meeting that's going to be in March for the HVAN. We're going to review the physical study update and discuss the cost modeling project and review and discuss the home visiting funding partnership activities. So let's move on to talking about some updates. Oh, the equity lens. Yeah, we want to be sure and we had agreed back last fall to always um, apply the equity lens for any home visiting systems committee decisions. So this is just a review of those questions if people want to look at those briefly. And then we can move on.
Okay, I believe Callie is starting us on some COVES updates today, including the COVES regional work plan. And Callie and Ron are both here to share about the evaluation team updates for COVES.
Great. Thanks, Rebecca. And Rebecca and Ron, please chime in if I skip over something you wanted to draw attention to. First, around the regional work plan, Kristen Miyamoto has been leading that process of clarifying the scope of work that will support regional home visiting systems change and is beginning the outreach process with those who are involved in regional home visiting system coordination around the state to identify their priorities for how COVES can support implementation and provide any technical assistance over the coming year. So that information gathering process is getting underway alongside a new community of practice, which is beginning to meet alternating months for those also directed to those who are involved in regional home visiting systems coordination. And they've identified, at least preliminarily, an interest in conversations that really focus on regional approaches and strategies to outreach with families, to connect them to home-based services and other family supports, additional family supports, in particular when a family's perhaps first choice of any service is full, so that they can be supported either while being waitlisted and or find alternate forms of family support and stabilization services. Around evaluation team updates, we have a couple of efforts that we wanted to share more on today. The first is around the system survey, and just earlier today sent an email reminder and invite to all committee, collaborative, steering team, and family leaders to participate in the survey. So thanks to the couple of folks who from the committee have been able to participate so far. Since it was launched in mid-December and knowing that folks probably had time away planned, we wanted to extend that request by date to the 23rd. And so just really would appreciate all committee members being able to set aside over the next week or so 10 to 15 minutes to complete that survey. It really is important to having a second data point that we could compare to from 2024 to understand those who are involved in home visiting systems, change leadership kinds of roles, your perspective on the change process, areas of strength and opportunities for continued growth, and potential priorities for the coming year. So thank you again to those who've been able to, and thanks in advance for folks in hopes that you will be able to over the coming week or so. We've had already almost 90% of the family leader group participate, which is commendable, and so happy that we're going to be able to include their perspectives this year. And Ron Joseph has been leading the effort to coordinate with the 3 regions that have funding through COVES via the Ford Family Foundation for regional coordination. And together, they also participated in a similar survey with a total of 66 participants, which is a 73% response rate. And so we're feeling good about being able to reflect back to the system perspectives at regional and state levels towards the end of February, early March. And then the additional update I wanted to share today is around the home visiting enrollment data work group, which since mid-2025, when we first began meeting approximately monthly, and includes work group members that represent each of the state level home visiting programs and are familiar with the data system or the data for each. We've been engaged in a process to obtain, compile, and report each program data and in aggregate across programs across the state. And for the first time, being able to drill down a little bit more in greater detail to look at home visiting reach by county and to some extent for demographic groups across the state or at the state level as a whole. So I'm co-facilitating that with Lizzie Tremaine from DELC. And we did experience some delays in obtaining some of the data due to programs needing to direct their staff time towards food stability and insecurity efforts last year, and then some data sequestration at the federal level. But we've got what we need to move forward. We're doing member checking now and look forward to having at least some of that data compiled and ready to share towards the end of February and early March. Right, I'll pass to, let's see, is this going back to Peg unless there's any questions?
I had a question about the learning communities.
Yeah.
Are they all throughout the state?
That's a great question, Peter. Right now, there is representation, I think, from, and maybe Rebecca or Ron have this information at the tips of your fingers, 6 regions around the state. And so I can't recall off the top of my head, Peter, if that includes Southern Oregon and additional regions. But certainly, if not, we can also double check with Kristen Miyamoto to make sure that outreach has happened. And if there is someone or someone's you'd like to make sure get that information, let's make those connections. As with any of the committee members thinking about regions that you might be connected with as well.
Great. And it's great news about the enrollment data work group. If we can, the more data we can get in terms of participation, the better.
Great, thank you.
If there's no other questions, we'll move on to Early Learning Council updates. I'm trying to think when we last met. The Early Learning Council had a very productive retreat in Salem in late October and uh, continued to kind of establish our priorities for the next year. Certainly, home visiting remains a high priority for the council, and obviously supporting coves and so forth. We also agreed to prioritize childcare and workforce development in early childhood education, um, and have an upcoming meeting at the end of this month as well. Peter, did I forget anything major?
No, I think that's pretty much it. The childcare issue we had a lot of discussions about childcare and still kind of struggling to figure out, how do we have a statewide conversation about childcare? And where does that come from? No resolution on that. But it is a strong concern from the council.
And any other home visiting news or updates from any other programs or departments that are represented? Kate.
Thank you. I couldn't find the raised hand. I just raised my
That
hand.
worked. That worked.
That worked, right? So I just wanted to let everyone know that OHA received $1.97 million per year for 5 years for the Rural Health Transformation Program. It's a little interesting because it was part of the HR1 bill, where they took away a whole lot of stuff over here and then gave us this little bit here. It sounds like a lot, but every state got somewhat of a floor of $1 million, but they could apply for more. Oregon applied for 2 million and got 1.9. So that was pretty good. Washington got 1.8 million per year for 5 years. In that are some provisions to support home visiting. And so there are kind of three parts to it, or three rollouts, if you will. There's the Catalyst projects, which are the shelf ready, must get implemented, must get funded by March, and have meet some sort of a metric by August to be able to report to the feds in September. And so within that, because then the next year funding depends on how well the state did in this 9-month fast and furious crazy implementation. So the Family Connects program was called out as having a shelf-ready program, if you will, to expand. And it's all about expansion. It's not to supplant. And so we're working with our LPH, our local public health authorities, to identify up to 5 rural sites that are willing and ready to rock and roll and start planning come March. We have interest in about 7, so that's really hopeful. And this may be our only opportunity to expand that program given the current state budget situation, at least for now. So we're pretty excited about it. Pretty excited that it's really focusing on rural sites. In some ways with this model, the rural sites, the implementation seems to go a little smoother. I don't know why. Well, there's lots of reasons why, but every site is unique too. So we're pretty excited that this is going to happen for us. And then there's a whole lot of other stuff. I will put in the chat the link to the Oregon Health Policy Board presentation about the Rural Health Transformation Grant, the PowerPoint. It goes through everything and it's very clear, and it kind of shows you what all's in there. So there's a lot, like with hospitals and coordination, but I'm also thinking that some of the regional coordination work would be appropriate for some of the grant, not this Catalyst group, but maybe the direct grant or the RFP granting that happens next year. So.
Well, it's nice to hear some good news.
Yeah.
Yeah. Any other announcements or share outs?
Kate, were there any other, I had heard that there was not a huge focus on children in Oregon's application. I'm just curious if there were any other significant places where kids were mentioned or opportunities for the shelf-ready stuff.
Yeah. It's interesting because the people that were at the core of creating the application are all child, youth, and family-oriented policy analysts. But there was a lot of community engagement as much as they could fit in the time. And so there's a stronger maternity emphasis, I think, maybe more than a child health, but I think it can be woven into whatever comes forward. And then in December, they had that intent to apply survey. And so people could put in an idea that they would have. And I think out of that, there came some child health pieces as well. But I do think, from year to year, it's going to be a year-to-year game. Just depending on how the federal government rolls this out and what they deem meeting metrics means and all of that. But I think it's just not necessarily elevated, but it's within each, which I know that's problematic because you got to call it out to make it, elevated. But yeah. Bless you.
Anything else? I think we can move on to the McVie update.
All right. Thank you very much. Really appreciate the opportunity to come back and meet with you all. Drew Strayer, he, him, his. I am the McVie project director and serve under Pamela Ferguson and Kate Wilcox. And again, glad to be here. Thank you so much. I have a couple items that I want to just share with you all quickly. First is we had our site visit in the end of October, which went very well. And so first off, I just need to praise the McVie program team here in Oregon and the assessment, evaluation, and informatics team led by John Putz. They have all come together and done amazing work preparing for a very heavy lift. And the end result was we had about 8 areas. They said, hey, we'd like to see more in these 8 areas, which I don't mean to minimize it, but much of it is documentation of documentation. So what documentation precisely did you review when you verified compliance, that kind of thing? And so for most of it is a very simple fix of literally just cataloging each document we view, which that'll take some time, but it's a small task. Couple other areas that were interesting was they wanted more specifics when it comes to local implementing agencies, the local programs, who they hire, how do they train them, that kind of thing. And so we will begin doing a better job of tracking some of those details to really see who is getting hired at the local level for the McVie funded programs and reporting that back to HRSA. Yeah, that was really the focal point of much of that. Most of these are resolved before the week was even over, before the 3 days was even over. A couple of them have taken development of a tracking system, which is just simple Excel documents, Excel spreadsheet that we are working with to work with the local programs on that. And speaking of how we monitor the local programs, we are going to be starting that subrecipient monitoring program for 2026. Very soon, the notice will go out to our local implementing agencies. giving you all the heads up, we're going to Eastern Oregon and we're going to visit with our local implementing agencies over in Eastern Oregon, as well as any that are in a difficult spot with staffing, with enrollment, with data tracking, data management, those that are on a supportive action plan. And I kind of talked briefly about that last time. But so all the programs in Eastern Oregon and any that are in a supportive action plan will get additional attention from us this year, just due to the risk, avoiding the risk there. So we will be following up with them. That will probably occur between March and May. That gives us time to work with them through the summer before the end of the McVie fiscal year in September, so that they can be ready to go with a new year and new contracts. Any questions on either of these so far? All right, I'm going to keep rolling. The next update is our next application. We got a little bit of a heads up, somewhat unofficial, that we should be hearing within the week or two about the new application for McVie funding. We do know, we did get the notice that we will be able to apply for just over 10.8 million. The expectation is we will receive the full amount. It does require, however, 650,000, just over that, in matching funds, which is funds that are identified as being spent on an evidence-based home visiting model here in Oregon that do not come from federal funding, not federal money. And so we have a close working relationship with Department of Early Learning and Care and their Healthy Families Oregon program. And so they have graciously agreed to track some of the funding that they are already spending from general funds, verifying that it's spent, and using a formula to figure out approximately how many families were served by that funding that they are already expending. And by us reporting that to HRSA, they agree to give us 3-to-1. And so that will return $1,857,921 to Oregon, just based on that expenditure that Healthy Families Oregon is already doing. And so that application will likely be due mid-April. So that is the timeline on that. I have one other item that I wanted to add in real quick, is just family leadership is vital for McVie. And thanks to the kind folks at Coves, we have a live request for family leadership participation, providing advice, listening ear, providing feedback on some of our decisions and processes, just to make sure that we are not acting alone, but we are acting in concert with others. So those would be the 4 items in rapid fashion. Any questions? I see Kara has a question. Yeah, so there is a bit of additional funding. However, it will basically keep us steady, given how McVie funding is it reauthorized every 5 years. We have a base funding amount that stays steady, and then they approved and provided some additional funding each year, which has basically allowed us to keep our head above water when it comes to local programs operating their budgets, remaining solvent. And some of this McVie work is there's a lot involved in the documentation side, as I kind of mentioned a little bit ago. And so it's a little heavier than just running Healthy Families Oregon, Early Head Start Home Base, or Nurse Family Partnership on its own. And so maintaining that basic funding level is where we are. I guess I can also say we did lose one of our LIA local implementing agency partners this year due to a combination of enrollment capacity and funding level. However, that same amount of family service is being provided by another one of our partners. And so we are maintaining the same model balance that we have had. And so much is remaining the same. Thank you.
Thanks, Drew. I think we're moving on to Rebecca and a little update and on HVAN.
Yeah, thank you, Peg. So it was really wonderful to see many of you at the launch of the Home Visiting Action Network in November. That was a greatly anticipated effort on Cove's part, and it was great to see so many collaborators there. So as a reminder, the Home Visiting Action Network, or HVAN, is meant to be a way to participate in home visiting systems change work that is open for anyone and everyone that's interested in learning about and contributing to it. And the Early Childhood Systems Change Theory of Action, which is pictured here, outlines the vision, approach, values, need for investment in resources, and strategies for change that we are utilizing toward the outcome of healthy and supported families in Oregon. So I'm always looking for every opportunity to reshare the theory of action for systems change, just to make sure that we're grounded in it as we're moving forward. And I just put it in the chat, and it also was sent out as a PDF after the meeting summary that came out after the Action Network launch itself. And so in just kind of thinking about what we know about how the meeting went, out of 98 participants in that first HVAN meeting, 26 people completed a feedback survey. So that's only about 27% of participants. So we were really glad to get some great feedback, but also understand that many people did not share their thoughts about the meeting yet. So we wanted to share a couple of highlights that can be helpful for us to understand strengths and opportunities for improvement, as well as how some participants experienced the meeting. So people commented largely on what was important to them about the meeting, as providing an overview of the home visiting system and the connections between different areas of work, as well as having opportunities to connect with each other, both of which are explicit goals of the network itself, in creating a space that has not existed prior to the launch of it. And then some opportunities for continued growth and improvement for the Home Visiting Action Network include offering more time for participants to talk with one another and to describe more direction and opportunities for participants to have an actionable role as part of the network. So that's very exciting to me that people are interested in knowing what can they do, how can they be, involved, making those connections. So of 22 individuals who responded to the question about the HVAN helping them learn more about what is happening in the early childhood home visiting system in Oregon, 95% of people agreed or strongly agreed. And then of the 20 individuals who responded to the question about the Home Visiting Action Network being beneficial to them in their own work, 90% of participants agreed or strongly agreed. So we're hoping for more evaluation participation next time around, just because we want to make sure that any information we're getting reflects the broader group as much as possible. But we were delighted to have so many people there. And there's a lot more details in the link I put there in the chat for you if you'd like to learn more about some of the pieces of that Home Visiting Action Network launch. And if we can move forward. Thank you. So some reflection questions for you today, and just a few quick minutes in case you have some reflections that you would like to share. We're curious about thoughts you might have about the use of the equity lens, how it has been applied or how it can be applied, what you feel the Home Visiting Action Network can do for you in terms of your organization or agency, and goals in home visiting, and then also what thoughts you might have that sparked for you about how you can support the Home Visiting Action Network, both as a committee and as an individual in your role. And then also an additional question could be what the Home Visiting Committee would like to bring to the Home Visiting Action Network for input. So knowing that we have this body of individuals gathering to be focused on home visiting, who are excited to learn about what's happening in the home visiting systems transformation in Oregon, and their request for wanting to know, what specifically can we do? How can we be involved? How can we engage? How can we help? Just want to kind of put the question out there to the committee to potentially think about whether you have, as a body, things that you would want to learn from the Home Visiting Action Network participants, or kind of any specific requests or ideas, anything that you're wanting to put out there to that group. So I've talked quite a bit. I'll pause for a second for any thoughts that you have. And we, of course, will send this information out in our follow-up to the meeting so that you can reflect further and reach out to us so you're not put right on the spot. But if you have any reflections you'd like to share, that would be great. Peter?
Yeah, I just want to emphasize the importance of making sure we're aligned, that each one of the hubs in the state is connected to the Home Visiting Action Network. So as we're working to expand services as much as possible, that we're aligned with the work the hubs and the CCRNRs do.
Great, thank you. That's making me think right off the bat, knowing that hubs, many staff at hubs, and CCRNRs are on our email list, but thinking also especially about how we get information out about the Home Visiting Action Network, wanting to make sure that we're checking carefully that the information is going out to those folks.
Yeah, Peg, let's early learning hubs. Yes, sorry, I should say the whole thing.
Thank you. Any other thoughts or reactions, or if you were at the Home Visiting Action Network launch, any reflections that you have that you'd like to share? Okay. Please do feel welcome to reach out to COES if you have any additional thoughts, or respond when we send out the materials after this meeting. But then on our next slide, we have a draft agenda for the next Home Visiting Action Network meeting. So again, as a review, the intention for the HVAN is to meet 3 times a year, 2 times remotely, and 1 time in person, which that in-person meeting would potentially be taking place of the annual Home Visiting Summit. So we're working with the various leadership and advisory groups to get an agenda going for the next Home Visiting Action Network meeting. Based on our poll that went out, the identified date and time for the next meeting would be Monday, March 30th, I believe from 1 to 2:30. I'll double check that in just a second. And so as we're working on that agenda, we have like very similar in many respects in terms of spending some time welcoming folks, providing a little bit of background about the home visiting system, but of course much more briefly this time since that's been established at the previous meeting, checking in on norms and alignment to Raise Up Oregon 2.0, as well as this area of action. Around breakouts, we had a great suggestion to have the breakout time this time based on strategy area of interest, and to let people spend some time together in groups talking about that. And also we're intending to give a longer period of time for those breakouts so people can connect in that way. Some leadership and work group updates, and because there are so many groups within the home visiting system, we recognize that we can't really have detailed updates from every group at every meeting. That would be a very long meeting, but kind of wanted to really focus in. So the home visiting committee would be a group to focus on, in part because our at least in our draft agenda, we have an intention to focus on the home visiting fiscal and funding projects that have been under the direction of the committee specifically. So kind of wanted to resurface the committee, who's on the committee, a little bit of background and the purpose. Also, the family leadership group is a potential group to highlight, as they've been really doing a lot of great work as they get established and begin to get ready to integrate into many of the other work groups and advisory and leadership groups. And then a community awareness work group potentially would be featured. We're right in the middle of working on launching that. And if we're far enough along to have some updates with that, it would be great to be able to focus on that a bit. Peg, I see, is there a visual crosswalk of all the work groups and their purposes at a high level? Yeah, we have, I apologize I didn't include in this slide deck specifically, but that graphic that has kind of the turquoise rounded corner rectangle that it's meant to be the Home Visiting Action Network, and then it has the groups within. But I think for sure, actually, I'll just pause and let you tell more about your thoughts on that.
I mean, just when you said we don't even have enough time to have the work groups, I'm like, what are the work? I mean, I think I know, but I feel like it's a pretty convoluted structure, um, in some ways. So I feel like just for my purposes, like I was trying to explain all these committees within Health Share, and I just need like a elevator speech for what is the purpose of each of these, and thinking about how they like efficiently interact with each other.
Yeah, Peg, thank you.
And I do remember that visual now that you mention it.
Yeah, and I'd be happy to send that to you as well as a PDF along with some materials that we have that can kind of give that high level overview so that you have that to share out when you're talking. And I think also, you know, in your region in particular, where there's regional work happening in many ways in parallel with that has its own I think funding and fiscal group and kind of this group and that group. And so I can see how particularly in your area it would be extra complicated and challenging to discern. But I do think the that one graphic that we've talked about, and again, apologies for not having it in this slide deck, could be helpful for that. And I'd love to connect, but just knowing that the Home Visiting Committee, the collaborative, and the Cove steering team, along with the family leadership group, make up the leadership and advisory groups. And then there are some work groups based on the 5 identified strategies in the theory of action for moving home visiting transformation work forward. And those 5 strategy areas being building leadership, which of course the leadership and advisory groups are a part of, and then supporting workforce. So we have a corresponding workforce work group, community alignment. So the changing mindsets, sorry, community awareness, changing mindsets group, improving access is not a group quite yet. The data enrollment work group is kind of working on things in that area. And then finally, the increasing resources, which we're focusing on today in this committee meeting. So that would be funding and fiscal. And happily, we have both of those projects highlighted today. But I do understand how there's the complication and then also the groups being really based out of that theory of action and those 5 strategy areas for implementing change. Yeah, but also for others, if you have places where you're trying to explain things about a home visiting system change and finding that you would like some supportive materials to help connect that and make it clear to others, we'd be happy to provide you with materials to do that. So please do reach out. I'd love to do that. Okay, and then looking at the agenda again, just let's see. So breakouts, leadership and work group updates, opportunities. We used that last time as a time for people to share, kind of make announcements about things that they have going on, and really we included that information in the summary afterward, so that there's information not just coming from Coves or from the specific leadership groups, but people are getting those opportunities for kind of cross-pollination, networking, learning about opportunities having to do with home visiting. And then getting into kind of the specific theme and topic for this second Home Visiting Action Network meeting, which is the same as the topic today in the committee, focusing on home visiting fiscal and funding projects, including fiscal study and cost modeling projects, the home visiting funder partnership projects, which include Leadership Learning Toolkit and exploration of home visiting services account. We're going to be learning a lot more about both of those here in just a moment. And then potentially a regional connection. We'd like moving forward to look for opportunities to have a regional connection at each home visiting action network to kind of get into, you know, all the conversations at a statewide level about what this work can look like, but also looking for those kind of practical regional applications of what these ideas look like there. So we're wanting to approach the SAFE project folks about potentially sharing about their work. And then finally, including some action steps for participants to take and share. as they are sharing information about this work with their home communities. So we'd love to hear any thoughts you have, either now or if you'd like to reach out after the fact about things you'd like to see on the agenda, or any questions or concerns you have before we move on to hearing from the Prenatal to 5 Fiscal Strategies team. Peg.
Yeah, I'm just wondering if there's a opportunity or a reason to include state and federal, any legislative updates, given it's at the end of March. I mean, there's just a lot of conversations about funding and cuts and coming cuts, and I don't know exactly what it would be, but it seems like we really should, that's like a big elephant in the room, as I always say. So we can talk about all these work groups and plans and everything, but what are there implications coming at the state and federal level that are going to impact home visiting?
Absolutely. I think that's a fantastic idea, and we can go ahead and strategize on who will be sharing those updates. But yeah, thank you. That's great. Okay. I don't want to spend too much longer on this. I want to make sure to move on to the P5 team. But if you have any questions or comments, please do reach out. Thank you, Peg. Okay, and I believe Gina Capito and Kristen Davis are here from the Prenatal to 5 Fiscal Strategies team to share.
Hi, Rebecca. Thanks so much. Yes.
Everyone.
Gina, did you? Yeah.
Nice to see you all. Thanks for having us. Kristen's gonna start us out, but good to say hello to all.
Thanks so much. So, if we could go to the next slide, we wanted to start with a little bit of a fiscal study analysis update. So, on the next slide, we have a little snapshot of the timeline that kind of goes back to the beginning of the fiscal analysis process and kind of brings us up to present date. So, we really started with the interviews with both state and local agencies to really learn about those federal, state, and local funding streams, looking to identify how to support possible leveraging of funding to really address any of the identified gaps that were in the current home visiting system. And then from there, we talked back and forth with the fiscal study work group to really understand and identify how they wanted to transition and look at those funds, which really led us up from that point into starting to talk about the cost model and looking at the cost model and a systems model, both two models that would really support the development of the home visiting system and understanding how funding streams are coming in and possible ways of leveraging funds and having documents that would support as different agencies begin to look at how they might want to build out future home visiting programs. And so in thinking of that, we're going to talk a little bit more about the cost model. So if we go 2 slides up, one more. So we'll just do some base around what is the cost model. And so at its heart, the cost model is an Excel document that enables you to be able to look at really understanding the true cost of providing services to children and families. And so the tool will look at estimating the cost of providing those services, aligning with some user selections that the fiscal study work group will work in collaboration with Gina and myself to develop. And then it'll take a look of what those impacts are from funding of those multiple streams that we looked at in the fiscal analysis. And then we'll look at multiple data points and sources, which are all going to be driven by the selections that will be made by the fiscal study work group in collaboration with other discussions that we'll have throughout the state. And then ultimately, it will provide an output for an annual cost per child value. That value will help everyone understand when they are building a model, when we're thinking about future projections, what that annual cost would be, potential changes that may come, reduction of slots, increasing of slots, just to really understand how programs might be able to tailor certain home visiting programs to different communities and areas. So you want to be able to individualize all of the home visiting programs that are in the cost model by looking at that to be specific across the need that will be assessed from each community. And so, will you get the same answer or a single answer from the cost model? The only answer that you'll ever get from the cost model is if you make the exact same selections. So we will dig into that a little bit more later about some of the selection points that they are, but you can alter that and build out and tailor a program that talks about salaries and benefits and possible model specific changes that you want to, that an agency may want to make that will alter the answer that will be received from the cost model. And so cost answers always vary by the program type and intensity. So there's multiple caseload levels that we can look at. And then it also determines by the program size, how many children and families are being served, the ages of those children, regulations, and definitely equity and quality enhancements, which we will talk about a little bit more later as well. So, as I mentioned earlier, there are two different tools that we're talking about. The first is the direct service cost model, and the second is the systems cost model. And one point that we really want to talk about is that the direct service tool will support the system model questions that will be answered. And so, maybe a little bit later in this conversation, we just want to kind of lightly touch on some thoughts that we might have around some system questions that we might want that tool to answer. But this slide really just talks to the difference between the two tools. A little bit to highlight is that the direct service cost model really looks at identifying that true cost of providing direct services to children and families based on those cost drivers and revenue sources that are coming into the state, and really analyzing multiple data sources and points at one time to think about what that serviced approach will look like, what it may look like now, and then give you the opportunity to really plan for other enhancements and think about future projections if you truly build out a program that meets the need of children and families without having to really overload those home visitors. And then when we think about the system tools, it really speaks a little bit more to those supports under the program for delivery, thinking about funding and governance, and understanding how all of those cost elements come together and truly map out the service needs and understanding the needs of the community, and then building a direct service program that responds to those needs. And so the system model really looks at that infrastructure, as I was just saying, and really takes into account that the multiple different home visiting programs that might be in the state as a whole and how they assess each individual community. And then some of the basics of the direct service functioning, model functioning is it really focuses on those expenses of operating a home visiting program. So when we think about direct service, we're thinking about that personnel level, mandatory taxes, benefits that are supporting that staff. There'll be the opportunity to look at some different salary ranges depending upon what the physical study work group settles on. And then there's also opportunity to look at benefits at varying percentages and levels. And then we also look at non-personnel expenses, and then really look at the cost drivers by specific model requirements. So as I mentioned earlier, there'll be an opportunity to think about positions and really staffing to meet the need of the community, and then also thinking about reducing caseload size beyond what the model currently requires, and then also looking at other model characteristics, and then thinking about optional enhancements to build onto the program. So we're thinking about infant mental health, and also thinking about increased professional development, just to name a couple of things that the group will look at as far as some optional enhancements. And then we have the outputs. As I mentioned, those are going to be an annual cost per child, by child or family, and then the outputs are going to differ based on the model that is selected and those specific characteristics, and it will also be determined by the choices made by using the cost model. So ultimately, if you want to be able to compare and multiple home visiting models in one space, you'll be able to do that with the Excel. And however, we're not suggesting that one model is better. It's really to look at the cost of providing the services that that individual community may need based off of a needs assessment that may be done, and then assessing what that looks like and what the true cost of that is, and then building the program to then support the community. And then you'd be able to make those selections that I talked about off of that. And so before we move to the next slide, I'm going to pause here because I'm going to pass to Gina to talk about some more of the model options before we go into a little brief discussion. But I just want to check to see if there are any questions about either the systems model or the direct service model. Yes, I think it's Callie. I don't want to mispronounce your first name.
Yes. Hi, Kali. My question is on the personnel side. Are you looking at actual wages or what living wages should be? Because I think what we currently pay is not what should be paid. And so I'm just curious of how that factors into the personnel costs.
Absolutely. So yes, there is, first to answer your first part of your question, there is an opportunity to put in current wages that the program is actually paying. And then we usually bring three options: the Bureau of Labor of Statistics, or BLS. We also look at MIT living wage. We look at two compositions with that, a single person and a family composition with that. And we bring all of that together, and then we kind of land on what is closest to where we want to be with salaries, and then that there'll be options that will be plugged into the cost model where you can choose and play with that, or you can even do a user input where you can set the salary that you want it to be based off of the benefits package as well, so that you know exactly what that cost will be.
Wonderful. Thank you.
Absolutely. Other questions?
I'll just flag also regarding salary. Sometimes in states or communities, there might be another measure of living wage or cost of living that folks are interested in exploring. We, as an organization doing a lot of cost modeling across the country, have landed on the MIT living wage calculator because it is a pure living wage measure. There is also the self-sufficiency index. Sometimes things, when you're building a tool, they have other things sort of built into the measure. The living wage calculator as a salary value then allows us, we also include then discretionary benefits and paid time off and other things, so that we kind of, it's a pure salary value for us, and it's the employee side of living and what they need, their cost of living. And then we're able to quantify with the tool all of the other expenses of operating the home visiting program and sort of keep those concepts clean from each other. So it's just something that we've landed on as our best practice using that particular tool, but we also explore other tools. In fact, we have a state that we've built the self-sufficiency index that was built for them. I believe by the University of Washington actually is who houses that, and it's built for that state. So we folded it into their cost model for their childcare cost modeling. So we explore other salary measures, but as a minimum, to Kristen's point, we introduce living wage to address exactly what you're raising, that current salaries are not sufficient for the experience, the expectations of home visitors, right? When we really think about what we expect of people. So we are not looking to just model what currently happens, but looking to model what the true cost of home visiting is.
Okay, if we could, thank you. So this slide speaks to some of the differences in the model options. And so when we're thinking about that direct service cost model, we are really focusing, as we just had the conversation about the salary selection, those benefits, caseload options. We have a enhancement for rural services. So if we're thinking about the different wear and tear that may be on a person's car, longer distances, maybe the need for a smaller caseload because you want to account for those travel distances in there. Parent-child groups that are not included as part of some of the model basics. Reflective supervision is an enhancement. We talked about professional development and those infant early childhood mental health services, along with some model affiliation fees. And those fees would be outside of the basic fees. So we're thinking about curricula add-ons that a program may choose to do with those model affiliation fees that can be put in at a percent amount, or you can put in a flat rate. And then when we think about some of the options that come when we are building the systems model, we're thinking about the type and the number of services that are going to be included. What are those varying outputs based on direct service model selections? So as we mentioned earlier, that the direct service cost model will answer the questions that we are going to pose in that systems model. And so we're thinking about the data on those child and family needs, community specific needs. Where are we looking to see? Are there areas that we have identified or the state has identified that additional home visiting services may be needed, or an area that's not receiving home visiting services, and how can they access those services? And then really digging into the infrastructure components of what that system would be to build a system that is supported throughout the state for that longevity that the physical study work group has talked about. And so in thinking of that, we want to go and move into a little bit of a discussion to think around what possibly could be some of our system questions. And so I think I'm going to pass to Gina to kick us off for the discussion.
What we thought would be helpful as you're getting kind of a first pass at the concept of both of these tools and how they relate to each other is kind of taking a step back and hearing a little bit about what your thoughts would be on how the system could use these tools, whether the direct service tool or the system modeling tool. And then in particular, what questions you hope that either of the tools, so sort of exactly that question on salary and compensation, that staying with where we are on compensation is not viable. Doesn't support a sustainable and attract a workforce, nor does it support the delivery of services. So it's that sort of thinking about what you want to be able to model, to then be thinking about basically fiscal projections. Like, what will it cost if we're growing home visiting, if we are investing in it with full compensation for our workforce? What are those costs going to look like? So we wanted to just hear a little bit with some of this kind of short presentation, piquing your interest in the models themselves, if there's anything in particular that comes to mind that you'd like to see the system using these types of tools for.
I'm glad to jump in. I mean, I think this is really exciting. I think it's be fantastic to be able to look. I know that the South Coast Hub, Early Learn Hub, has been doing basically work to develop a baseline for the number of families accessing home visiting services, and we've been in discussions about setting a goal of increasing the percentage over the next 5 years. If we could increase the percentage of families by 5% or 10% or what it might be, this is going to give us the ability to say, okay, now we can figure out what that would cost and what it would cost if we actually are paying living wages and actually helping the economy of the South Coast by paying living wages. So this is going to be very helpful for those discussions.
Great. So some regional planning for sure. Okay, that's great to know.
And Gina, besides this group, who else have you shared that presentation with?
Well, actually, we have the fiscal study work group, which is a small group. There's a few folks from this group that are also on that work group, and then a few other state agencies are represented on that, as well as folks with different kind of stakes in the implementation of home visiting. And then we have a few future presentations. In fact, the Action Network that Rebecca was just detailing, we're going to be sharing with them and getting some input in the modeling from them. But we are looking to ensure that, and this is part of building models well, that if there's any other constituent groups that we should be engaging in, asking questions of, kind of thinking about that they might have a different vantage point on components they'd like to see in the tool, that we're hearing from from those groups. So we're always open to hearing if there's other groups even that are maybe a little more adjacent to the home visiting system that you think we should be connecting with. We'd be happy to engage in some input gathering.
Well, I'm thinking out loud because, we got this short session that's right in our forefront. And I was just curious if there were any legislators that you or your team was going to appeal to during the short session. And I can see Mr. Buckley smiling because obviously when you start bringing up elected officials, you could get any and everything. So, it just depends on what you're willing to share or even ask.
Mm-hmm. Yep. Our experience from working across several states around using modeling tools has been a range of different engagement with the elected officials, both locally and state level. And depending on sort of where they are in the process, sometimes it's just a matter of education on the idea that Oregon is interested in a cost-based approach to understanding home visiting services. And so it's just, we are doing this work. This is an approach that we're using. Oregon also uses it for understanding the cost of childcare. So there is some system level thinking across to your early care and education field or your prenatal to 5 field, which is sometimes just nice to kind of make sure that your legislature is aware of that, because that it's good work that is trying to understand what something costs to really understand how your public investment is purchasing the service and how much of the service you're able to purchase with your investment. So it's a very sort of data informed thinking about the public investment. There's also the opportunity to kind of talk a little bit more about why an ask may be growing, and it's that which may be a little bit more of once the model's done, you're educating on that idea of the difference between current compensation and the compensation the workforce needs, and how that means there's a different dollar amount that we should be paying for our home visiting services. And that is, obviously that's a point of education, but it's also a point of sort of defending an ask
Right.
and sort of saying we're likely going to be looking for more resources because we are currently under investing in our programs, and we have the data to explain why.
And just as you said, when you think about those salaries, it sounds like to me you and Kristen, you guys are trying to find the happy medium in the middle, right? When you think about folks' salaries, because that's when you start talking about money, you're going to get a wide variety of folks' opinions and thoughts about that. So I appreciate you both sharing this because it's a good insight on what's happening. So thank you.
But I also really like the idea of even seeing what the legislature would like to see in a tool, right? There's that question too. Everybody has the opportunity to kind of think about what they'd like a tool to be able to do.
Well, I definitely will not suggest which legislators you should talk to. I will not put any of those in the chat because I'll be biased, so I won't say anything there.
Hey, Peg.
Yeah, you guys, you mentioned that you've done this sort of project across other states. I'd be curious to know if you've seen examples where regions or states who have leveraged something like this really effectively, and how. Especially, I'm just thinking of in this time of like shrinking budgets and everything. Anyway, I'm just curious if there are some like, oh, Delaware did this amazing thing, or Minnesota or whatever. I mean, you don't have to answer that right now, but I'd be really curious if you have examples of how other places have leveraged this kind of tool well.
Yeah, I can jump in with a pretty quick example from a couple states specific to home visiting that sort of builds on the idea of potentially dwindling resources. New Mexico and Illinois both have home visiting direct service cost models. They both use them as part of rate setting. So under the contract value, in essence, right? In the case of home visiting programs, for their McVie funded programs, as well as in both states, they have general fund that supports home visiting. So they have more than one funding stream, and they've used them to understand the cost of the service and then think about how, when they then go to set contracts across the different funding streams. In Illinois, the funding streams aren't all at the same place. currently. In New Mexico, they are. So it's a different exercise because they're able to say, okay, here's all of our money and here's how we're putting it out to programs and here's how we're consistently setting rates for programs. That's something that many other states are sort of working towards, is having their different agencies come together around a common tool and then think about how they ensure that you don't sort of push false competition because one agency sets a rate for healthy families different than another agency does. Things that just are not productive within a system when you're trying to take a system approach. In both cases, they have used their cost model for that basic understand the cost and use it to actually pay rates. They've also both used it to move how they pull in other funding streams. Primarily, initially, the Medicaid funding, and really move on understanding what the Medicaid rate should be, because Medicaid rate setting is very different than how we go about setting payment rates or contract values for childcare or home visiting. So working with that system on what Medicaid rate setting is and having a cost output to say, this is why the rate actually needs to be higher for home visiting. Otherwise, both states had experience with pretty low Medicaid payment rates for home visiting that wasn't really incentivizing for programs to leverage it. Programs were looking at the dollar amount and saying, I cannot deliver a home visiting program on that amount of money per home visit. That does not come anywhere near to what my annual cost is. So the cost model and that having that at the system level provided a sort of a one-to-one partnership with the rate setting to really unpack cost and understand it more, again, from like a more of a pure data perspective, which is much more in the line of how the Medicaid rate setting process works. So instead of bringing just kind of feelings about the fact that the Medicaid rate wasn't enough, we were able to partner with the rate setting team in both states for several months around understanding what the cost of home visiting is to drive the Medicaid rate to be more inclusive of the services that home visiting does actually cover. They also then have used it in New Mexico in particular to ensure that then they have a layered funding approach at the program level so that they are not putting in from say the general fund or the contract from McVie more money than what would get to 100% of the cost, because they have that cost value. And if the Medicaid's going to pay X amount, and then here's the amount that the other source pays, they actually are really showing what a layered program budget can look like, because they're, again, basing it all against this. We have a cost output. We understand the choices we made, what the salary points are, and what the cost of delivering the service. So it's helped them to really think more systemically, for sure, but then also leverage in funding and in a more sort of intentional way. How do we leverage this funding in? And as you all know, working with Medicaid is one of the things that for many home visiting programs or systems, it's you should be leveraging this money. There's a lot that goes into that. It's very easy to say that you should be using Medicaid to fund home visiting. There's a lot of capacity building for programs, understanding there is a cost with leveraging an additional funding stream. How do we quantify that? The cost model allowed for a lot of those questions to be answered really concretely. But it's not a like overnight solution either. In fact, going to be doing some trainings next month with programs around the layered funding model using here's the total cost and here's what your different funding streams can support and here's how you're made whole by those different funding streams. So it definitely takes capacity building. I just saw Peg's question in the chat. Probably the closest thing, no, there's not a white paper on the Illinois work. There's a few different presentations on things. And then New Mexico is actually going to be publishing this week their 5-year finance plan, which talks more about their cost model, and it talks more about how they use that tool to set rates and then do 5 years of projections for service growth. It gets a little bit more into those bigger system questions, sort of like what Peter raised around, how many children are we trying to serve and how much does it cost? So it's a little more than just the idea of how they use their cost model, but it's definitely a key piece of their finance plan. So that'll be something I think that'll be good to share with the group when that hits the streets, probably next week, one day. So you can kind of see some other system thinking at work to support you all. I think, Callie, did you have your hand? I realize that you might be changing to your phone. Did you want to go in with a question? I think your hand was up, wasn't it? Oh.
Yes, it is. It was, I had a quick question.
somewhat to the legislative conversation, and I guess it's maybe a question for Peter. Have legislative leaders asked for this information or agency leaders ask the council for this information? I'm just, I guess, curious.
Legislative leaders have definitely not asked for this, except for there's when we've testified or even had the meetings with legislators, and I think even part of those discussions, there's confusion about, how many home visiting programs would we have, and why are exactly we're trying to get to X level of funding. So it's not that they asked for this, but this specifically, but this is going to be helpful in those future conversations, so we can say to
Okay.
them, okay, what do you want to know about statewide, or what do you want to know about what's happening in Eastern Oregon?
Yeah,
Etc.
no, I agree. I think this is important. I find the legislature to be very confused about all things related to early childhood funding. So
Yep.
that's why I was curious. And I think the more education they have, the better on the real costs to support our young children and families.
Absolutely.
Yeah, sometimes the questions that get asked are not the same as what we know we have the tools to answer. So then it's a little bit about like how we use the tools to drive the question. Tomorrow morning, I'm going to be in New Mexico training legislative staff on the tools. They've been using cost models for almost 6 years now, and this is really the first time that we're engaging with this way on the tools themselves with the chief of staff for both the head of their finance committee. So it takes time for folks to sort of embrace that, oh, we have a tool that answers these questions, right? But they ask other questions, or they sort of make other concerned statements about this is too much money, we're spending too much. And so then we use these tools to answer the question of why it's not too much, why it's what we need to be doing. And actually that we probably could be investing more to get to the true cost of the service.
So, thank you, Gina. So we'll wrap up so that we give some more time for the rest of the meeting. So some of our next steps are we're going to continue collaboration with Coves and with the Fiscal Study Work Group to build out that frame for the systems model, and then we'll continue discussion with the Fiscal Study Work Group to build out the frame for the direct service model, thinking about those selection variables that we discussed, and then also brainstorming with key constituents to the questions that we received about who all are we speaking to. So if there are additional identified agency directors or other key constituents that we should speak to, please let Rebecca or Callie know. They will get that information to us so that we can make sure and reach out to them directly so that we can make those connections. And so thank you again. Maybe we will be engaging some more so that we can make sure that the systems model is really reflective of and answering the questions that you all really want to get the heart of the answers to. So thank you so much for today, and we look forward to seeing you soon.
Okay, I see my name on the screen, so I will not wait for a introduction. Hi, everyone. Kara Copeland, she, her. I've been at this meeting several times, so I think I have 2 slides, but I want to focus our time on this first slide, which is this home visiting, the exploration of a home visiting shared services account, because this is very much connected to the conversation that we were just having. First of all, remember back in September, we're in that big room, we're putting dots on posters. Want to remember, why did we decide to focus on this? This is one of the strategic initiatives, the big ideas really that we wanted to explore as part of this work group. So the Home Visiting Funders Partnership is a work group of this committee, and is one of the work groups within our theory of action. So since we've last met, we were able to graciously start a partnership with a national organization called Start Early. They've done a tremendous amount of work on childcare for Oregon and have worked with many organizations. I want to just pause briefly and let my colleagues, Judy and Megan, just briefly introduce themselves so that when you hear them, you know why they're here, and I'll explain a little bit of what we're doing together. So, Judy, do you want to just do a brief
Sure.
introduction?
Hi, everybody. It's great to meet you all. Some of you I know, and Gina and Kristen, it's great to see your work in action again. We love partnering with you all too. So I'm Judy Wright Parker. I'm a director on the Start Early Consulting team, and I'm going to drop a link in that gives you more detail about our consulting services and our organization. But I will say that Start Early is an organization that does direct service in Chicago and provides home visiting, doula services, Head Start, and early Head Start to quite a number of families in the Chicago area. And we also do consulting on the national level and support states like Oregon. And Megan and I work remotely. I work in the other Portland. I live in the other Portland. So I'm on the other side of the country, but also in a coastal state with a purple leaning similar to Oregon. And it's great to meet you all. I'll turn this over to Megan.
Thank you, Judy. Hi, everyone. I'm Megan Turner. I am a manager on the Start Early Consulting team. I live in Upper Marlboro, Maryland, but I am just outside of Washington, D.C. And I just have to say it's been really exciting to hear all the amazing work happening in Oregon. And I am super excited to be working with Kara and Rebecca, and can't wait to continue to see all of how everything unfolds in Oregon.
Great. Thanks, Megan. I appreciate the partnership and the collaboration that we have with the Children's Institute, which is how we were able to have this added capacity. They're going to be working with us on some of the strategic deliverables related to this part of the work plan for the Home Visiting Funders Partnership. I want you to imagine today is Tuesday, that it's Taco Tuesday, and that you are going to buy tacos. And when you go to buy tacos, you have to pay for them out of 4 different bank accounts. And it becomes really complicated. But what would happen if you just had one bank account and the taco vendor wouldn't know which bank account you were using, but it just came from one source? That's my illustration. I don't know if you're hungry, but that's my attention getter of what is a home visiting shared or home visiting services account. This is what this account is called in Washington, and a few other partner states have created out of many funding streams one account where all funding goes into. Now, I will say, Kali and Dr. Brown, legislators have asked us about why is funding of home visiting so complicated. This exploration is part of our response to their questions of why is home visiting funding so complicated? Is there a way to better align our funding? Are there other solutions? So what we are doing is this exploration of a home visiting services account. And I'm going to tell you just briefly what our plan is, but what I want from our time together is to gather what are key questions we should be answering in our discovery process. So our process is to do these partner conversations, what we call the discovery. We're going to be meeting with state agencies in the January and February. We're going to be working on the connections with other states that are doing this and learning from them. And then in the end zone, what we're marching towards, I'm getting excited about Super Bowl coming, is in May, hope to have a panel of other states coming and presenting and interacting with the Early Learning Council. So that's my high level overview. My question for this group is if you all could interact around what are key questions that you hope this process over the next from now until May, what are key questions that we need to have answered? Let me just leave it there. What are you thinking about? What are those key questions? Yeah, Kate.
Thanks for indulging my arm. This is really exciting for all the reasons that have been stated. I do think one of the things we're going to have to really explore is how did other states get from where we are to where they are? Because if we choose to go this route, it's going to be a lot of shifting of perhaps statutes, political will, all of the various, issues that come into that. So it would be great to understand and maybe hear kind of what were the lessons learned as those states moved from something that was more decentralized to something that was centralized.
Great.
Kara, this is the right work to be doing. I think this is excellent. It really, it seems to me you almost have to, we need to make the case for home visiting until more legislators understand it. And the outcomes that we receive when home visiting programs have high participation in any region of the state. And then we need to be able to say, and I would love the idea of having this one account where we could say, if the legislature and the governor want to increase home visiting in one section of the state, whether it's on the coast, Eastern Oregon, whatever it be, we'd have the ability to say, okay, through this formula, you can see, through this account, you can see how that would play out in terms of how many Head Start slots would increase, how many other home visiting programs would increase in that region. So again, just making the case for the worth of home visiting, making it easy for them to understand how to increase participation. I think this is just really important to get done.
Kara, can I ask a question as a group? Again, I'm just curious if you all have wondered about if there are other states that you would want to add to the list. I mean, I think after Gina and Kristen's presentation, we would add New Mexico, Illinois, maybe. I mean, I think what we're looking for are states that have a coordinated effort, right? And then that can look really different state by state, and that's okay. What we're mostly interested in is sort of what are the states that have, as Kate said, have gotten to that place of more centralized approach. So I see Kara put in North Carolina and Iowa. Are there any other states that people are curious about that you'd like us to add to our and Peg, you asked if there was a white paper on Illinois and New Mexico. There will be something written here about all of these states. That's one of our deliverables.
I have a question. I don't have a state, but a curiosity around cost savings and efficiency. I mean, it would seem to me that a centralized system is a more efficient system. And I do hear questions about cost savings or, sort of, as everyone has talked about, we're in a restricted revenue, era. So I feel like this is a move to do something that increases efficiencies and potentially expands services. I don't know if that's a true assumption, but if it is, I'd love any sort of case study that substantiates that for legislators and other leaders.
Yeah, yeah, that makes sense. I was also wondering about metrics, right? What are these states measuring, and how are they measuring it across, all the different models that they're supporting? Which also would tell us about some efficiencies.
Yeah, that sounds right to me as well.
And certainly, Kali, thank you for bringing that up. I see this connection of the system level, the P5 work of if we can get a baseline for what our system costs across in the current statute or in the current way, can we then model out that the difference of like would a different model is there a cost savings or are there other benefits or distractions? I think it's all of these data points will help legislators inform an approach.
Well, in alignment, typically there is a value proposition to alignment, which is essentially what this is about. So I don't see the downside. I have one other question. I can't see hands, so I apologize. Is there another hand up right now?
Nope, go for it.
Okay. I have a wondering around how a centralized system could ensure that we are getting culturally specific home visiting services to populations that need it. We've had ongoing challenges with our bilingual populations accessing bilingual home visitors all around our state. And I think it applies to other groups. And we know how important this is for home visiting to be effective. So I'd be curious about that linkage.
Great question. Okay, I'm going to hand back to Rebecca because I think I'm out of time and the committee's out of time. So that's where I wanted to spend my time on that first slide.
Kara, thank you so much, and apologies that we squished you a bit in terms of timing. And thank you to the P5 team and the Start Early team for sharing. And I think we're passing on to Peg to wrap things up.
Yeah, so I just wanted to thank all the presenters. This was really helpful today, and lots of really good information. So thank you. Hopefully, as many of you as possible can join the Home Visiting Action Network, the HVAN meeting in March, and it is from on the 30th of March from 1 to 2:30. And our next meeting will be in May. If you haven't responded yet to the scheduling email, please do so to Rebecca. We're hoping that it's going to be the 28th at this same time. That'll be a Thursday. And then in June, we'll have the HVAN again, and we will meet again in September. But please respond to that scheduling email so we have results of that. Again, thank you everybody for attending, and it was a good productive meeting. So thanks.
Thanks, everybody.
I'm putting our email in, Rebecca, into the chat. So if people want to ask us, things later, we can do that. Okay.
Wonderful. And I'll be sure to include that in follow-up materials as well. Thank you, Judy.
Thanks, everybody.